Hi, it's Steph here. Welcome back to my channel. As more and more jurisdictions allow pharmacists to prescribe Paxlovid, I want to share some practical tips from my experience dispensing this medication to hopefully reduce your time that you spend doing this. If you're new to dispensing Paxlovid, I'll link you to some resources that you can refer to in the video notes below. I don't want to go over what you can already read in this video, but I think it'll be helpful to share some of the issues that we've encountered so that you're able to anticipate them or prevent them from happening. Tip number 1. You need to emphasize to the patients exactly how to take it. If you look at the blister packs that Paxlovid comes in, you'll see that it contains 3 tablets that the patient must take all together, depending on their renal function. Briefly, this is because Paxlovid contains a combination of 2 medications, the nirmatrelvir, which is the antiviral component, and the ritonavir, which binds to an enzyme that would otherwise break down the nirmatrelvir to allow the nirmatrelvir to stay in your body longer, to allow for the 2 times a day dosing. Therefore, it must be taken together so that the ritonavir can act on the enzyme to prevent it from degrading or breaking down the nirmatrelvir. I find that patients who are explained this rationale for why the 2 or 3 tablets must be taken simultaneously together are less likely to take the medication wrong. The reason I bring this up is because we've had patients call back to the clinic 10 days later saying that they still have 5 or 6 tablets of the Paxlovid remaining when they should have already completed the course. Upon further digging, we realized that these patients were taking the tablets one at a time, such as 1 tablet once a day, when they should have been taking all 2 or 3 of the tablets concurrently. Therefore, it is very important to spend time on this counseling point to ensure that they take the medication correctly, to allow for therapy effectiveness and potentially to prevent resistance developing to the Paxlovid from the COVID virus. The second tip that I want to share with you is that it's helpful to give your patients a heads up that they might get a metallic, bitter taste in the mouth when they're taking the medication. Inform the patients that this is common with therapy and that it'll go away after they complete the treatment course. This will hopefully lessen the number of calls that you receive after they go home and start taking the therapy and then experiencing this bitter taste in the mouth, because they know to expect this and they know that it's transient and they know what to do about it. For some patients, this metallic taste in the mouth can be unbearable. According to an advisory board post, so this is a company that does a literature search on current and trending healthcare topics, they suggest that to prevent this side effect from occurring, patients may consider coating their mouth with peanut butter or chocolate milk or chewing some cinnamon gum right before taking the Paxlovid to prevent this from happening or lessen this metallic taste. And finally, here's some tips that I want to share with you when assessing for Paxlovid drug interactions. Don't worry, it's not as scary and time-consuming as it seems. You'll get faster with the more Paxlovid you prescribe, review, and dispense, because you'll find that many of these drug interactions are common amongst patients and that you'll see them over and over again. When assessing for drug interactions, I like to compare between different resources because sometimes you'll get different information from different sources. And after comparing it, I'll use my clinical judgment, such as what are the strength of evidence, does it make sense pharmacokinetically to reach a decision on what I want to do with this drug interactions. So some of the drug interaction resources that I use when reviewing Paxlovid therapy include the Liverpool COVID-19 Interaction app. I love this because it allows you to input all of the patient's concurrent medication and select Paxlovid, and it kind of runs a drug interaction analysis report, kind of like Lexicomp, but specific for COVID-19 Paxlovid therapy. They have a mobile app that you can use, and they also have a website, and I'll link you to the link in the video notes below. Another references that I like to use to compare with the information that I get from the COVID-19 Liverpool app is Lexicomp, as well as the Paxlovid drug monograph. However, none of these references are exhaustive and does not include all of the medications that you'll encounter. Do not assume that if a medication does not pop up in the COVID-19 Liverpool app that there is no interaction. You'll need to do further digging just to make sure you're not missing anything. So here's another tip for you. I find that for more specialized medications, such as for chemotherapy drugs, it's helpful to go to your local cancer agency's website to see if there is a drug monograph for that specific chemotherapy agent and see if there is a section on any drug interactions with CYP3A4 inhibitors like ritonavir, for example. So in Ontario, we have the Cancer Care Agency's chemotherapy drug monograph that you can refer to, and in BC, we have the BC Cancer Agency's chemotherapy drug monograph. This may also apply to other more specialized medication taken for specific disease states. And if you still can't find anything in the drug interactions app, the drug monograph, or the society's websites such as the cancer care agencies, then you'll need to do a literature search in PubMed or Google Scholar. I would use keywords such as ritonavir or CYP3A4 inhibitor with the medication that is in question. The reason this is important because you might find some case reports or case series reporting on interaction between ritonavir and the medication that you have in question, since medical evidence evolves quickly, and sometimes we have new drugs that are newly marketed that we don't have much data on. And lastly, also take into account the pharmacokinetics of the medication in question. Look up the pharmacokinetics in Lexicomp or the drug monograph to see how it is metabolized and whether CYP3A4 or PGP is involved in their metabolism or excretion. Knowing this and knowing that ritonavir is an inhibitor of CYP3A4 and PGP will allow you to have a better understanding of whether there might be a potential drug interaction. And taking into account the medication in question's therapeutic index and what the potential side effect is, then it'll also better help you be able to determine whether this drug interaction may be minor or if it's potentially clinically significant. So this rigorous process of going through the literature, searching up PubMed, Google Scholar is really only necessary if you're not able to find the medication in these drug interaction resources or society's websites. I would say most of the time, you'll be able to find most of the medications that your patients are taking in these interaction apps. So you don't need to spend too much time digging into literature. However, I would say 5% of the time, you'll encounter medications that are not in these apps where you'll need to do a deeper dive. And it's important not to forget that both nirmatrelvir and ritonavir are also CYP3A4 substrates. So if the medication in question affects the CYP3A4 enzyme by either inducing or inhibiting it, it may also affect how Paxlovid works. It's also important to note the duration of the CYP3A4 effects of these medications. For example, for ritonavir, the onset of CYP3A4 inhibition effect is rapid and takes a few days for it to resolve after completion of therapy. So you'll need to take into account the duration of these enzyme effects when you're assessing for drug interactions, especially if there is not much data available in the interaction apps. Again, take a look at some of the resources that I've included below for more information on assessing for drug interactions with Paxlovid. Being given the authority to prescribe Paxlovid is an exciting time for pharmacists, as this demonstrates that our skills and knowledge are increasingly being trusted by the public. Use this time to shine and show the public what we can do. And let this be the stepping stone for further expansion of our scope of practice. I hope you found this video helpful. If you do, please consider subscribing to my channel as I put out weekly videos on practical tips and pharmacy pearls that I encounter in my practice as a clinical pharmacist. Till next time, bye for now.